On the 11th of December this year, the United Nations Children's Fund, UNICEF, marks 75 years of providing humanitarian and developmental aid to children worldwide. Here in Ghana, the agency has spent almost 40 years out of the 75 years in its global outreach, advocating for better healthcare, education and sanitation-related issues. As part of commemorating this feat and impact in Ghana, joint users Emefa Atiamo Eli toured the Jirapa Health Center with the UNICEF country director to assess the impact of support to the Ghana Health Service in that district. That report was first aired in 2019.
The COVID-19 pandemic has proven challenging to health facilities across the country, and the Jirapa Health Center is no exception, particularly with regards to maternal and child health care. Coupled with inadequate infrastructure and limited space, a number of services, including postnatal care, have had to be provided in improvised circumstances and spaces. To ensure quality care is not compromised and deliver optimum care for mother and child, UNICEF is collaborating with the Ghana Health Service in advancing various forms of support to the facility. A number of equipment and materials for the care and well-being of hospital staff have been provided for the health center. While providing care, the Ghana Health Service and UNICEF are critical about adherence to all COVID-19 protocols.
What's the weight? 5.7.
It is weighing day for children under 5. All clients will be attended to on the compound of the facility. It is largely due to the limited space and the large numbers and absence of a newborn care unit at the Jirapa Health Center. With the provision of mobile weighing scales, height measuring devices and record books, the nurses, with their protective equipment and sanitizers, diligently attend to every mother and child as they report. This is of utmost delight to the facility benefactor, UNICEF Ghana. And Claire Dufay is the country director, who is very much concerned about staff adherence to protocols while delivering care.
And we as UNICEF, we have disseminated guidelines on how to continue ensuring the provision of services during this pandemic. So of course there are some protocols you have to follow, including social distancing between the patients. So today they were weighing a baby, they were measuring the baby, they were checking the child and maternal health booklet where you have all the immunization records. I just want to mention that this booklet is really critical, and I'd like to call on the government to make sure that there is a budget line to cover the cost of this booklet.
The Jirapa Municipal Health Director, Florence Angsonweni, says the facility has not recorded any maternal deaths in the last 3 years. She's optimistic the provision of a NICU would greatly improve their performance.
What we need more here, especially on child health, is our neonatal and intensive child health unit, our NICU. We have a NICU at the hospital. It's so small, and people knowing where Jirapa is and what St. Joseph Hospital have done, we have them referring many babies, preterm babies, babies who are sick. They refer all of them to our neonatal and intensive care units, but it's so small. We are not having enough incubators. We are not having enough phototherapies. So we have us putting 2 or 3 babies in one phototherapy machine or an incubator. So this is an area we will need.
In a related development, their counterparts at the Golu District Hospital are excited following the commissioning of the newly constructed neonatal and intensive care units. Emilia Sechi is the senior staff nurse in charge of the new facility. She says they expect more cases following the opening of the newborn care unit at Golu.
Because before the NICU came here, we were referring most of our cases to Wa Regional Hospital, the municipal hospital before. And we realized that from this place to Wa is about 4 hours if you have to use the public transport. So most of the mothers were not going. You give them the referral letter, they wouldn't go. So before you see them, sometimes you'll be walking around and you meet the mothers in town and you ask about the babies. And they will tell you the babies are expired because they couldn't go.
Meaning they are dead?
Yes, they are dead. It was really disheartening.